We are going to talk about session notes. We're going to discuss what a session note is and why they are important. We are going to talk about why accuracy is so important while writing a session note. We're going to go over a session note section by section and offer helpful hints for writing a session note. Session notes are an essential job responsibility, and it is important that each session note is completed accurately and promptly. But what is a session note? Session notes are sometimes also called chart notes, or in some cases, SOAP notes, and they provide documentation of the session, whether it occurred or did not occur, and what happened during the session. A session note should be a standalone document that helps someone understand what happened during the session and what kind of progress the patient made. Session notes are written for insurance companies. It allows them to understand what happened during the session and to verify that Magnolia is uh, providing the kind of services that the insurance company has approved. Each note becomes a part of the patient's medical record, a long paper trail which documents the patient's ABA history and whether ABA is an effective treatment for them. Session notes are usually easiest to write soon after the session. We recommend writing session notes during the last 5 to 10 minutes of session or immediately after. All session notes are due 24 hours after the session. Accuracy is very important when it comes to session notes. All healthcare providers undergo audits. An audit is an insurance company examining session notes to ensure proper session times, the only authorized programs are run, and that the ABA provider is actually practicing ABA. A poorly written session note can fail an audit, which results in the insurance company recouping the money previously paid for services and possibly even terminating relationships with the ABA provider. Audits can occur years after the session note is written and can encompass one session note, multiple session notes, or even every session note for every patient that the insurance company covers. A failed audit can be a big problem for a provider. That's why our session notes are so detailed. We're going to go over how to write a session note shortly. It's also important to note that accurate session notes are important because they are part of the patient's medical record. Again, each session note helps to build a case that ABA is an effective therapy for our patients, so an accurate session note is an important part of that. There are many parts to a session note. As you can see, there are parts that are mandatory but pretty easy to fill out, such as the patient ID, your email address, the date, start and end time of the session, your name and credentials. There are other parts of the session note that are also mandatory but require a little more time. We'll go over each of these sections in detail and help to show you what an auditor might be looking for when they audit a session note and what Magnolia's standards for each of these sections are. When you write a session note, your session note looks something like this. When we get the session note at Magnolia after you hit submit, this is what the session note looks like. Actually, your session note goes to two different places. The first place your session note goes is to an Excel spreadsheet, which basically has your name, the patient's name, and your time in and time out. That's what we send to the insurance company. However, the rest of your information goes onto a Word document that looks something like this. When an insurance company does an audit, they look for this long form with all the details. So let's go over a session note section by section so you'll know exactly what to write and what auditors might be looking for. It's important to note while we go through this session note that insurance auditors do not practice ABA. So, our session notes need to be written in a way that someone who does not practice ABA can understand what happened during the session, the progress that the patient made, and how you spent your time. The first part of your session note is the basics: the patient name, your name and credentials, and the time that you submitted the session note. As you can see, one part of the session note is the MR code. This is your patient's first and last initials and 4 random numbers. It is important that you use the correct MR code when writing a session note for a patient so that patients with the same initials do not get mixed up. This RBT has also written their name and credentials. And as you can see, when you hit submit on your timesheet, there is a timestamp. This allows us to see that you have submitted a session note within 24 hours. The reason we ask that session notes be submitted within 24 hours is so that you can remember the most accurate information and so the insurance companies see that we have documented the session quickly after the session, meaning that we did not make up our data or the details provided. So to review, when writing your session note, you need to use the correct initials and 4 digits. You need to have your name and your proper credentials, and your session notes need to be submitted within 24 hours. The next part of the session note is the session info. You'll have your activity, such as behavioral intervention, or cancellation or non-billable activity, the day of service and date of service, and the start and end time of the session to the exact minute. It's very important that we bill to the exact minute and not round up or down. There are a few reasons for this. First, ABA bills by duration, meaning that we bill in 15-minute increments. Knowing the exact start and end time of a session allows us to know exactly how many 15-minute increments to bill the insurance company. Second, we cannot bill for ABA if the patient is not present, meaning if this session started at 1 o'clock but the patient was late and came in at 1:05, we cannot bill from 1 to 1:05. That's insurance fraud. So, start and end times to the exact minute. Very important. It's also important that we have the correct day and date of service, as well as the correct region and location of the session. If you are in 2 different locations within a session, such as when you go on an outing with a patient, or if you're at the center and then you take a walk to the park, you need to list all locations and the duration of time that you are in each location. To review, in this section of the session note, you need to list the correct activity, the day, date, time, and duration of the service, and all must be accurate and to the minute. You also need to list the location of the session. If you are in multiple locations, you should list the duration of time you were in each location to the minute. The next part of the session note are the session details, starting with the initial perspectives. The initial perspectives are the parent and MBT perspectives on the patient as the patient walks in the door. When you go to the doctor, they often do an initial analysis, usually by asking, "What brings you in today?" or "How do you feel?" This is the ABA version of "What brings you in today?" We ask parents how the patient is doing today. Usually the parents say good and try to leave. Ask them some follow-up questions. What made it a good day? When you're writing down what the parent said, try to use the words reported or stated or use exact quotes. This allows the insurance company to understand that you've actually spoken to the parent and are reporting what they said. This PT has written the patient's father reported he had been outside for 30 minutes and he was running from one end of the yard to the other. He also reported he had a typical or okay night of sleep. The RBT has reported any unusual events or environmental events that might have affected the patient's demeanor. So to review, When doing the parent perspective, use specific events and examples provided by the parent. Use words like reported and stated when rephrasing the parent's words and report. When a parent says he's having a good day, ask follow up questions. The next part of the session note is the BT perspective prior to the start of session. The BT perspective is really easy. Make an analysis. Is the patient happy, sad, energetic, lethargic? And then ask yourself, how do you know? Then you write, the patient appeared blank as evidenced by blank. Think of it as similar to the way a doctor might say, the patient's arm appeared to be broken, or the patient's throat appears to be swollen and we should do a strep test. So, in this session note, the behavior technician has written, the patient appeared to enjoy spending time in the backyard as evidenced by running around the backyard and popping bubbles. So, the BT has made an analysis. The patient appears to be enjoying himself and then explains how they came to that conclusion, as evidenced by running around the backyard and popping bubbles. To review, when writing the behavior technician perspective, make an assessment of the patient as the patient walks through the door. Document your assessment and your reason for the assessment using specific observation. Try using the words appeared, or as evidenced by, or as supported by. The next part of the session note is medication information and signs and symptoms of the patient diagnosis. Both of these sections are very important to session notes. First, when documenting medication information, you need to be accurate. If you're not sure if a patient is on medication, ask the parent or BCBA. When documenting the signs and symptoms of the patient diagnosis, you'll document which signs and symptoms of autism you observed during that session. This is very important because insurance companies contract with ABA providers to work on the signs and symptoms of autism. To review, when documenting medication, don't write, I don't know. Make sure you ask, and your BCBAs will often include this information in Catalyst. When documenting signs and symptoms, list the signs and symptoms of autism observed during the session.